Accordingly, we wanted to talk about another indicator. Again, I referenced a moment ago the issues of testing and tracing, which will be foundational to our broader efforts to get to those other indicators, and when retail stores open, when recreational opportunities are made available again. The testing becomes foundational in that effort. The tracing becomes foundational in that effort. I have a number of things I want to add to that discussion. And while it is true that we have provided testing for 465,327 individuals, that number is still inadequate to meet the needs of all of you and to meet our expectations as it relates to our capacity to begin to move even further in terms of augmenting and modifying these stay-at-home orders. So 465,000+ tests have been done. We went from 2,000 tests on average a day in March, just a few weeks ago. We made announcements with a new testing task force that committed to advancing that number to 10,000 by April 14th. Just a few days ago, we announced we're actually at 14,500 tests a day. Right now, we're about 16,000 tests a day. Forgive me for building all these numbers, perhaps confusing you, except to say from 2,000 at the end of March to now a goal by the end of April of 25,000 tests. 16,000 on average today, get to 25,000 by the end of this month. Our goal is north of 60,000 tests a day, and that's phase one goal. That's a short-term goal. Over the next number of months, we want to have a minimum of 60,000 tests. We're hoping to get closer to 80,000. So it's 60 to 80,000 is the framework, the minimum being 60,000 tests a day. Our entire PCR test, that's the swab-based test, capacity, the instruments that exist in the state of California, if 100% were at full throttle and everybody was being tested because we had all the supply chains intact and ready to go, be about 95,000 tests we can conduct of PCR tests. These are not the serological tests. I'll get to that in a moment. But the PCR test, the swab-based test that many of you recognize, the instruments have the capacity to get up to 95,000. We believe that we can get not only to 25 shortly, but get to that 60 to 80,000 range within our existing framework of expectation of when supplies are coming in, when more equipment will avail themselves, and when more sites present themselves in communities all across this state. And that's something else I wanted to share with you. We are significantly increasing the sites of availability at the same time. We're increasing capacity within the existing system. There are hundreds and hundreds of testing sites in the state of California, well in excess of 600. But there are 251 core sites that really make up the backbone of our testing system in the state of California. We did detailed surveys of those 251 sites about what they need to increase capacity. 50 to 55% of those that we surveyed said their #1 need is swabs. Others suggested they need viral transport methods and the old media that is used to take the swab and put it into a little kit and send it off to be diagnosed. The diagnostic side, less stress, though always critical. The RNA extraction, the reagents, substantially many of those roadblocks have been lifted. Still an issue, but not as significant as half of those that were surveyed saying it's really now getting the specimen that's the bigger issue with our testing capacity. I just got off the phone with President Trump less than an hour ago. We had a very specific conversation about not just the survey, but the need for swabs, a very pointed and honest conversation. The president secured and gave me the confidence that we will receive just this week a minimum of 100,000 swabs. That's the ability to collect 100,000 specimen samples. That will be forthcoming to the state of California this week. He said then we will be provided 250,000 swabs next week And he said, third week, expect to see a substantial increase above the 250,000. That was a very good phone call. I want to thank the president not only for being available for a phone call at a moment's notice, but being willing to directly commit to all of us in the state of California to a substantial increase in supply of these swabs. That will go a long way to give us all more confidence that we can meet some of these testing goals, these stretch goals, and assuage the concerns around those 251 sites that have reported a need for more swabs. So that specifically is an advancement on our commitment to do more in this space. But we have a second commitment that we are making public today to do more, and that's a commitment to make sure all Californians are tested. What I mean by that is not all 40 million of us, would be ideal, but in every part of the state where we're not leaving communities behind. One of the big struggles we have had in the last few weeks of this pandemic is getting to rural and remote parts of this state and getting up testing sites and making them available. One of the other vexing and frustrating things is getting into our urban centers and making sure that we're getting into Black and brown communities and doing justice to people that are also underserved, even in these remarkably enriched and robust and well-resourced communities. And so today, we are announcing 86 new sites that will become operational, that are focused from a socioeconomic lens, focusing on Black and brown communities and focusing on rural communities. We've put together a heat map of the state where we define testing deserts, and we're going to begin to plug these programs into these sites. The two companies, Verily, they'll provide 6 of these sites. That's the partnership we announced a few weeks back with Google. And then the other is OptumServe, and they're providing 80 specific new sites, end-to-end testing. These sites will provide the kind of continuity that we need to ultimately advance our collective goals in this in this state to reach these testing goals. So I want to just thank those two companies for the robust conversations we've had in the negotiations, and I'm very pleased today to make that announcement that we're moving in that direction. In addition to that, we made a commitment with Abbott Laboratories for 1.5 million serological tests, 1.5 million serological tests at 130 facilities in the state of California. I caution people in this space, as I've been cautioned in this space, around serology, broadly defined, the focus on antibodies and immunity. I know that it's been a point of real attention, particularly the work that was done recently on serosurveillance, which is serology tests with a community surveillance mindset that was done in early April, first by Stanford University in Santa Clara, 3,300 or so tests, and then on April 10th and 11th in partnership down in Southern California at USC. Those tests got a lot of attention, but they also generated a little bit of controversy about what they are and what they're not. We don't use serological tests for diagnostics, still traditional PCR, again, swab-based tests. There's still some open-ended questions around serology and antibodies and immunity. And I just want to caution people in this space. A lot of energy, a lot of enthusiasm in this space. I share that energy and share that enthusiasm, demonstrably so, with the deal we made with Abbott just on the 1.5 million tests with them alone. But I caution all of us as that information comes in, as more peer review is being done in this space, that all of us start to understand, while it can be extraordinarily helpful in terms of guiding our framework and indicators for reopening, it's not at this moment a panacea. But it could be profoundly significant, and we are certainly going to do our part. In addition to procuring PCR tests, we will do the same to provide the serology tests to people all across this state. Much easier test these bloodborne-based tests and much more capacity to deliver those tests. But again, our testing numbers are predicated on more traditional PCR tests at the moment, and that's the foundation to which we will build. Accordingly, our foundation in terms of testing doesn't mean much unless you can begin protocols to track and trace. We in the state of California have a long history of testing and tracking and tracing patients. The history of TB, measles, the health departments all throughout the state of California, county health departments have been running testing, tracking, and tracing protocols for some time. STDs, gonorrhea, very robust tracing that's been done throughout the state of California in that space. HIV, a lot of testing and tracing and tracking is done in that space. I say all that to make this point. We're not starting our tracing program from scratch. Quite the contrary. You have trained professional workers in local health departments that do this every single day. The question that's asked of us now is to do it at a scale that we have not seen. But the good news, again, is all of that resource is enriched and exists and persists all across the state. So we want to build bottom up on that work. And what we've been doing is surveying not only the local capacity and workforce, but the ability to retrain and reprioritize the state workforce. We have a governmental group called GovOps. They've been doing surveys of state workers to see if they're willing to do different work and help support our tracing and tracking efforts. The good news is we believe we have the capacity to build an army of tracers, beginning with a goal of 10,000. And that is now our stated goal, to train these tracers, get 10,000 folks up and operational, again, building off the local infrastructure, supplementing it as we can at the state level, and supporting it to the extent with any volunteer workforce. But we want the professionals first to guide these efforts, as these tracing is not just about numbers, it's about quality. And that quality, again, is about enriching the work that's been done at the local level. We've got a new training academy that we'll be putting up online in this space to help support that work of those 10,000 individuals, and we'll get an aggregated data set that will allow us to track the trackers and track the tracing that's done throughout the state of California. Currently, again, decentralized, and we'll begin to organize it in a more centralized manner. So 86 new sites, testing sites in rural California and deep in urban California to make sure we are truly culturally competent in our testing. Capacity to increase our testing by multiples, aided and supported by the support today that the President offered in terms of our specimen collections. The capacity, again, to support that tracing that ultimately will lead to questions of isolation, which has to be regionalized, and quarantine, which is an economic issue as well, which is part and parcel of what Dr. Galley is here to talk a bit more about. And so he'll dive deeper into this space, but I want you to know this space is one of 6. Not all 6 are equally important indicators. All of them are important. But this one may be among the most important in terms of our capacity to make subsequent announcements in terms of how we're starting to loosen up our stay-at-home order. And so that's why we felt today it deserved a little bit more attention and a little more intentionality in terms of not just our focus, but socializing that focus here with you. So